Imagine walking into your own bathroom, looking in the mirror and seeing a complete stranger staring back at you.
Oh, yeah. That is it's a terrifying thought.
Right. But for someone with advanced dementia, that isn't a hallucination you can just brush off. It's not a nightmare. That's just a Wednesday afternoon.
Yeah, absolutely. And for decades, the medical response to that kind of severe cognitive decline has been honestly mostly passive resignation.
Like just treating it as this slow, inevitable fade.
Right. But today, we are completely ripping up that old script.
We really have to. And that's exactly the foundation for our deep dive today. We are pulling from this massive stack of recent sources for you.
Oh, it's a mountain of data.
It really is. We've got the updated guidelines from the World Health Organization, the latest Lancet Commission report, data from the Alzheimer's Association, and several cutting-edge medical journals.
The newest stuff out there.
Exactly. And we have a very specific twofold mission for you today. First, we're decoding this whole new era of early detection and prevention.
Which is incredibly exciting.
It is. But second, and honestly, I think this is the most crucial part. We are extracting highly practical, day-to-day advice for caregivers.
Yes. The people actually in the trenches right now.
Right. People managing the behavioral symptoms of dementia every single day.
Yeah.
Because that is where the real daily battle is fought, isn't it?
It is the absolute hardest part of the disease. I mean, it's one thing to understand the science in a pristine lab, right?
Yeah.
But it's entirely another to apply that science when a loved one is, wandering the house in a panic at 3 a.m.
Exactly.
We really need to bridge that gap between the clinical data and your living room. And you always do such a great job of cutting through that heavy medical jargon.
Oh, well, I try. But I need you here to connect all these dots for us.
Yeah.
Let's unpack this. Before we get into the actual day-to-day caregiving playbook, we have to establish why the medical community is suddenly so optimistic.
Right, the paradigm shift.
Yeah. Because if we look at the updated 2024 Lancet Commission and the WHO guidelines, there is a statistic that it stops you in your tracks.
The 45% number.
Yes. Up to 45% of future dementia cases could potentially be prevented. Almost half.
It's staggering. It completely reframes how we view the disease. We aren't just sitting ducks anymore.
And so how do we actually reach that 45%?
It's achieved by targeting 14 modifiable risk factors across a person's entire lifespan.
Okay, so things we can actually change.
Exactly. And we've known about the usual suspects for a while now. Things like smoking, physical inactivity, obesity, excessive alcohol consumption.
Right, this stuff that's basically bad for everything.
Yeah, pretty much.
Mm-hmm.
But the Lancet report recently added 2 critical new factors that are super interesting.
Okay.
High LDL cholesterol in midlife and untreated vision loss in late life.
Okay, so the cholesterol one makes intuitive sense, right? Like from a vascular standpoint.
Right, clogged arteries mean less blood flow to the brain. Pretty straightforward.
But untreated vision loss. Why would your eyes failing lead to dementia? That feels like a totally different system.
I know it sounds disconnected, but it really comes down to cognitive load and how the brain allocates its resources.
What do you mean?
Well, your brain relies on sensory input to basically map reality. So when you lose your vision, or your hearing for that matter, your brain is suddenly receiving all this degraded, fuzzy data from the outside world.
Oh, I see. It's like your brain has a limited broadband connection.
Yes, great analogy.
If your eyes and ears are failing, the brain has to use like 80% of its bandwidth just buffering that sensory input. Just trying to make sense of blurry shapes or muffled sounds.
Exactly. And that leaves almost no bandwidth for memory processing or critical thinking.
Wow.
That is a perfect way to visualize it. You are forcing the brain to work significantly harder just to process your basic surroundings.
Which has to be exhausting.
It is. It drains your cognitive reserves over time. So by simply getting your eyes checked or wearing prescribed glasses or using hearing aids, you are freeing up that bandwidth.
You're like literally protecting your brain's architecture from early exhaustion.
Precisely. And this idea of protecting the architecture is perfectly aligning with how our medical technology is evolving right now. What's fascinating here is how the Alzheimer's Association is heavily emphasizing blood-based biomarkers now.
Biomarkers in the blood. So we aren't just waiting for the memory loss to show up anymore.
Not at all. We can detect the biological changes of Alzheimer's in a standard blood draw. I mean, years, sometimes decades, before the clinical symptoms ever appear.
Decades. Wait, so we're starting to treat Alzheimer's kind of like heart disease?
That is the exact parallel the medical community is drawing.
Wow.
You don't wait for a massive heart attack to start managing your cholesterol, right? You identify the underlying risk and the biology long before the catastrophic event.
Right. You take your statins or whatever early on.
Yeah. So using these new biomarkers, we can see the pathology building up in the brain while the person is still, functioning perfectly normally.
Okay, but if we're detecting this through blood work decades before memory loss, we can't really view Alzheimer's as just this simple you have it or you don't binary anymore, right?
No, definitely not.
It has to be more of a gradient.
Exactly. It's a continuum. And the 2025 updates to the treatment guidelines actually break this gradient down into 6 distinct stages now.
Okay, walk us through those stages.
So stage 1 is completely asymptomatic. You feel totally fine.
No memory issues at all?
None. But a blood test or a PET scan, which is an imaging test that looks at cellular activity, it shows amyloid plaques starting to build up in the brain.
Okay, let's pause there just to clarify for anyone who hears that term amyloid plaques constantly, but doesn't really know what it means.
Yeah.
I always think of these plaques like microscopic rust building up on the brain's neural wiring.
Oh, that's good.
And as that rust accumulates, it eventually starts short-circuiting the electrical signals between your neurons.
That's exactly what they do. So in stage 1, you have the rust, but no short circuits yet.
Got it.
Then stage 2 involves subjective cognitive decline. You feel like your memory is slipping, maybe you're losing your keys more often, but if you take a clinical test, you still pass.
So the short circuits are tiny.
Right. Stage 3 is mild cognitive impairment, or MCI. This is where objective tests actually show a real deficit, but you can still live independently.
Okay.
Stage 4 is mild dementia, where daily activities start to get impacted. And then stages 5 and 6 are moderate to severe dementia. That's where you require significant, eventually full assistance.
I'm going to push back on this whole early detection model, though. I mean, on behalf of the families listening right now,
Okay, go ahead.
the global economic cost of dementia is already $1.3 trillion annually?
Right.
And that's driven largely by unpaid family care.
Yes, the caregiving burden is immense.
Right. So if I find out I have this rust in my brain at stage 1 or 2, what good is that early warning if there's no cure? Like, are there actual treatments that do something about the rust?
That is the million-dollar question. And the answer is yes, we do have treatments now, which is the major breakthrough.
Really?
Yeah, the FDA recently approved anti-amyloid immunotherapies, drugs like lecanemab and donanemab. But they are specifically designed for the early stages 3 and 4.
Okay, so how do they actually work? Do they just, dissolve the plaques?
Sort of, but they use your body's own immune system to do it. They're essentially synthetic antibodies.
Okay.
You get them injected into your bloodstream, they travel to the brain, attach themselves to that microscopic rust, and flag it.
Like a targeting beacon?
Exactly. They act like a targeting system, telling your immune system's cleanup cells, hey, this doesn't belong here, come eat it.
So what does this all mean? If someone in stage 3 takes this drug, does it cure them? Does it reverse the memory loss they've already experienced?
No, and it is absolutely vital we set realistic expectations here.
Right. False hope is dangerous.
It is. These drugs are not a cure. The clinical benefit is that they can delay cognitive decline by about 6 to 12 months.
Oh, just 6 to 12 months.
I know it doesn't sound like much, but mathematically, that is a meaningful window of time for a patient to get their affairs in order or, spend quality independent time with family.
That's true. Every month counts.
But it comes with a massive logistical burden.
Right, because these aren't just like pills you take with your morning coffee.
Exactly. They require intravenous infusions every few weeks.
Oh, wow.
And they require intense MRI monitoring because when the immune system aggressively attacks that plaque, it can cause ARI.
Yeah.
Amyloid-related imaging abnormalities. It's essentially microscopic bleeding or swelling in the brain. It is a very serious risk.
That sounds terrifying. Okay, what about people in stages 4, 5, and 6, the later stages?
For the later stages, those immunotherapies just aren't applicable. The rust is too extensive, and clearing it doesn't repair the neurons that have already died.
So what's the option there?
Traditional medications like cholinesterase inhibitors, think of the drug Donepezil, those remain the standard of care.
And how do those work if they aren't clearing the rust?
They work on the chemical messengers. Your brain uses a neurotransmitter called acetylcholine to send memory signals across the gaps between neurons.
Right, bridging the gap.
Yeah. In Alzheimer's, those messenger chemicals are severely depleted. So a cholinesterase inhibitor basically blocks the enzyme that normally breaks down that chemical. It allows whatever acetylcholine is left to pool in the synapse longer which helps bridge those broken connections.
So it's a workaround.
Basically, it helps stabilize cognitive function for a while, but it absolutely doesn't stop the underlying disease from progressing.
Okay, so medical advancements are giving us early detection and some ways to delay or stabilize the cognitive decline.
Yes.
But if you talk to anyone who is actively caregiving for someone with dementia right now, the real grueling daily struggle isn't just that their parent forgot a name.
No, not at all.
It's the behavioral changes.
Yeah.
It's the agitation, the hallucinations, the extreme apathy.
Yes, the personality shifts.
Medical treatments might slow the disease,
Yeah.
but they don't solve the immediate crisis of caregiving in the living room.
You've hit the nail on the head. This is known clinically as behavioral and psychiatric symptoms of dementia, or BPSD.
EPSD.
Yeah, and it affects almost everyone with the disease at some point. We're talking about severe sleep disturbances, profound depression, psychosis, and aggressive agitation.
Right, and this is exactly where we need to spend our time today.
Agreed.
If you are a caregiver dealing with a loved one who is suddenly aggressive or terrified of a hallucination in the hallway, what is the playbook? Do we use medications for this?
Well, there are medications. The FDA recently approved a drug called brexpiprazole, specifically for Alzheimer's-related agitation. And SSRIs can be used for depression.
Okay, so we do have pills.
We do. But here is the absolute crucial insight for every single caregiver listening. The first-line approach for behavioral symptoms should always be non-pharmacological. Always.
Wait, why? If a drug can just calm them down and make the day manageable, why wouldn't we use it? Is it just not effective?
It's not about effectiveness. It's about the massive risks involved. When you use antipsychotics or heavy sedatives on an elderly patient whose brain is already structurally compromised, you dramatically increase the risk of mortality.
Yeah.
You increase the risk of strokes, you cause extreme sedation, which leads to falls, which leads to broken hips, and then long hospitalizations.
And we know hospitals are terrible for dementia patients.
Exactly. Medications to alter behavior in dementia patients should be the absolute last resort.
Okay, so if we aren't reaching for a pill bottle, what does a caregiver actually do? Let's take agitation, for example.
Sure.
Someone's pacing, they're aggressively accusing you of stealing from them, they're just intensely restless. How do you handle that?
Instead of rushing to medicate, you have to look at the environment and the routine. First, you have to recognize that agitation is usually an expression of an unmet need that they can no longer articulate.
Like what?
Like, are they in pain? Are they hungry? Are they overstimulated by a really loud television in the next room?
Okay, but what if it's none of those basic needs? What if they're just agitated?
Then you use targeted behavioral interventions. Music therapy is incredibly effective for agitation.
Really? Just playing music?
Yes. Playing familiar music from their youth bypasses the damaged cognitive areas of the brain and taps directly into the emotional centers.
That makes sense.
It often instantly de-escalates anxiety. Also, tailored physical activities, just going for a highly structured walk, can burn off that restless energy.
That's very practical.
And a huge part of this is how the caregiver responds. You have to learn how to speak in a calm, low, non-confrontational tone. And the golden rule, you never aggressively correct them.
Right. Don't pick fights you can't win.
Exactly.
What about the opposite of agitation? The sources talk about apathy. And I think that's something that really breaks a caregiver's heart.
It is devastating.
Just watching a loved one sit in a chair, staring blankly, losing all motivation to engage with life.
Apathy is insidious because it's quiet.
Right. They aren't causing a disruption.
Exactly. The patient isn't yelling or pacing, so the caregiver often, naturally, just lets them sit there in peace. But profound apathy actually accelerates cognitive decline because the brain is getting zero stimulation.
Wow. So it's actively harming them to just sit quietly.
It is. So for apathy, the playbook involves behavioral activation.
But how do you activate someone who just refuses to initiate anything?
You remove the need for them to initiate.
Okay.
You don't ask, do you want to do a puzzle or do you want to go for a walk?
Because they'll just say no.
Right. The damaged brain defaults to no because making a decision requires too much cognitive bandwidth.
Oh, that makes total sense.
Instead, you gently prompt the action. You sit down next to them, put a puzzle piece in their hand and say, here is a red puzzle piece, let's put it right here.
Oh, I love that.
You establish highly structured daily routines to gently pull them into engagement without overwhelming them with open-ended choices.
You just guide the action. You don't ask open-ended questions. That is a massive shift in approach.
It really works.
What about psychosis? We mentioned the stranger in the bathroom mirror earlier in the deep dive. Hallucinations or delusions have to be the most terrifying experience for both the patient and the caregiver.
They absolutely are. And again, before you demand an antipsychotic from the doctor, you have to become an environmental detective.
What does an environmental detective do?
Well, if they're hallucinating strangers in the living room, check the lighting.
The lighting.
Yeah. As the sun goes down, are there harsh shadows being cast by the furniture that look like people? Turn on the bright overhead lights earlier in the afternoon.
Oh, well, so simple. And what about the bathroom mirror?
Patients with advanced dementia often lose the ability to recognize their own aged face. So when they look in the mirror, they genuinely believe a stranger is standing right there in their bathroom.
Which is terrifying.
Right. So the solution isn't a sedative. The solution is simply taking down the mirror or covering it with a towel.
Oh, man. If you are managing care for a parent right now, this is where you stop thinking like a nurse and start thinking like an environmental detective. You aren't managing a disease in that moment. You're literally managing the lighting in your hallway.
Exactly. If we connect this to the bigger picture, managing the environment is often way more effective than trying to manage the disease with heavy sedatives.
Okay, but what about delusions? Like fixed false beliefs where there's no mirror to cover up?
For delusions, the rule is cognitive redirection.
How does that work?
Let's say your mother is standing by the front door, insisting she needs to go to work, even though she retired 30 years ago.
Right.
Do not argue with her about reality. Do not pull out a calendar and try to prove her wrong. Arguing only breeds intense agitation because, in her reality, she is completely right.
So what do you actually say? Just agree with her?
You validate the underlying emotion.
The emotion.
Yes. She feels a sense of purpose and urgency. So you say, "You're always such a hard worker, Mom. Tell me about your favorite part of your job."
Oh, wow.
You pivot the conversation from the delusion to a safe, deeply ingrained emotional memory. Managing the environment and your own reactions is infinitely safer than a pill.
I mean, that's brilliant, but it sounds like it requires the caregiver to be incredibly attuned, hypervigilant, and just infinitely patient.
It is an exhausting role.
Right. I have to push back here. How do caregivers keep their own sanity? You're asking them to be an environmental detective, a music therapist, a de-escalation expert. And often, these behavioral symptoms disrupt the most basic human need, sleep.
Yes.
If the patient is up wandering at 2 a.m., the caregiver isn't sleeping either.
This is exactly the breaking point for most families, but it's also the most critical point for the caregiver's own health.
How so?
Because the lifestyle factors that help manage behavioral symptoms in the patient, things like sleep, diet, social connection, those are the exact same modifiable risk factors you, as the caregiver, need to manage to protect your own brain from developing dementia.
Okay, let's dive into that caregiver self-care, starting with sleep. The Cedars-Sinai research on this in our sources is absolutely mind-blowing.
It's revolutionary.
We've always known sleep is good for you, obviously, but now we know the exact mechanical reason why it prevents dementia.
Right. When you enter deep sleep, specifically what we call slow-wave sleep, your brain essentially undergoes a power wash.
A power wash.
Literally. The cerebral spinal fluid physically circulates through the brain tissue at a much higher volume. It flushes away neurotoxic proteins.
Including those exact amyloid plaques, that microscopic rust we talked about earlier.
Exactly. During deep sleep, your brain clears double the amount of protein waste it does while you were awake.
Double. So if you are chronically sleep deprived because you are up all night caregiving, you are literally letting toxic trash pile up in your own brain.
Precisely. And this is why relying on over-the-counter sleeping pills is super dangerous for long-term brain health.
Why? They help you sleep, don't they?
They induce a superficial state of unconsciousness. They do not induce the deep, restorative, slow-wave sleep your brain requires for that biological cleaning process.
That is wild. Okay, for actionable advice on sleep hygiene, the sources point to the 10-3-2-1 rule, which is incredibly easy to remember.
Yes, it's a great framework.
It goes like this. No caffeine 10 hours before bed, so it's fully cleared from your receptors.
Right.
No food or alcohol 3 hours before bed, so your body isn't focused on digestion. No heavy exercise 2 hours before. And no screens 1 hour before bed to let your melatonin levels rise naturally.
Implementing that routine works wonders for both the caregiver and the patient, honestly.
And if the caregiver is dealing with chronic insomnia from the stress,
The medical guidelines strongly recommend cognitive behavioral therapy for insomnia, or CBTI. It is a far better long-term alternative to sedatives because it retrains your brain's association with the bed and sleep.
fantastic.
Yeah.
Now, let's couple that nightly brainwashing with diet. We mentioned high LDL cholesterol as a major risk factor earlier.
We did.
The BDMS Wellness Clinic data highlighted the MIND diet, which is a hybrid of the Mediterranean diet and the DASH diet, D-DASH, standing for dietary approaches to stop hypertension.
Right.
The statistics on this are undeniable. Strict adherence to the MIND diet is associated with a 53% reduction in the risk of Alzheimer's disease.
It is incredibly powerful because of how it specifically targets brain inflammation and vascular health.
Here's where it gets really interesting, though. It's not some crazy restrictive fad diet. It basically just consists of 15 food groups. 10 you prioritize, 5 you limit.
Very manageable.
You focus heavily on leafy greens, berries, nuts, olive oil, whole grains, fish, beans, and poultry. And you limit red meat, butter, cheese, pastries, and fried food. But why does this specific combination result in a 53% risk reduction? Like, what is the actual mechanism?
Well, take berries, for example. They are highly emphasized in the MIND diet over other fruits.
Why berries?
Because berries are packed with flavonoids. These compounds cross the blood-brain barrier and specifically target oxidative stress.
Oh, nice.
They essentially act like tiny fire extinguishers for brain inflammation.
I love that image.
Right. Combine that with the olive oil and fish, which provide omega-3 fatty acids to maintain the structural integrity of the neurons. And you are ensuring the brain gets a steady supply of clean oxygen and nutrients. You are building up your cognitive reserve.
Okay, we hear that term cognitive reserve a lot. Let me make sure I've got this right. If sleep washes the physical pathology out of the brain and the diet fuels the vascular health, cognitive reserve is the brain's ability to just power through the pathology that we can't wash away, right?
That's a great way to put it.
It's like a muscular backup system. And surprisingly, the Rush University data points to our social lives as the primary way we build that muscle.
Yes. They followed nearly 2,000 older adults over several years.
Study.
Massive. And they found that frequent social activity leads to a 38% reduction in dementia risk. Furthermore, for those who were highly socially active but did eventually develop dementia, the clinical onset was delayed by an average of 5 years compared to the least socially active group.
5 extra years of independent cognitive health just from being social. But, what counts as social activity here? Is it just talking to the cashier at the grocery store?
No, it's engaged, everyday activities, going to restaurants with friends, attending community events, volunteering, playing complex games with relatives.
Real engagement.
Exactly. The biological mechanism at play here is use it or lose it. Socializing is not a passive activity. It is arguably the most complex mental workout a human being can do.
Right, because you are reading facial expressions, recalling shared memories in real time, following unpredictable conversational threads, and formulating empathetic responses.
Exactly. It forces countless neural networks across completely different regions of your brain to fire simultaneously and constantly. When you isolate yourself, those complex interpersonal neural circuits weaken from disuse. Social activity forces the brain to build redundant neural pathways.
And that redundancy is your cognitive reserve.
You got it. So if amyloid plaques do start destroying some connections, your socially trained brain simply routes the signals around the damage using the backup pathways it built.
Isolation isn't just lonely, it's neurologically dangerous.
It really is.
So let's synthesize everything we've covered today. We started by talking about how an Alzheimer's diagnosis used to feel like a definitive, terrifying endpoint.
A completely passive fade.
Right. But looking at the entirety of this landscape, from the Lancet's 45% prevention rate to the new targeted immunotherapies that use the body's immune system to clear the rust.
To the environmental detective work.
Yes. The environmental work caregivers can use right now to de-escalate behavioral symptoms. The power is increasingly shifting back into our hands.
It truly is.
Whether you are actively caregiving and need to remove a bathroom mirror to stop a hallucination tonight, or you're looking to protect your own cognitive future through deep sleep and the flavonoid-rich MIND diet, there is always a proactive step you can take today.
And this raises an important question for everyone listening.
What's that?
Look at your own daily routine, or the routine of the person you are caring for. What is one practical change you can implement this week?
Just one thing.
Right. Is it adjusting the hallway lighting at 4 p.m. to prevent shadows? Is it enforcing the 10-3-2-1 sleep rule for yourself so your brain gets that deep biological power wash? Because these modifiable risk factors compound over time into massive neurological resilience.
And I want to leave you, our listener with one final thought to consider. We just talked about how complex mental workouts and active social engagement physically build your cognitive reserve,
Right.
forcing your brain to create those backup pathways.
Yeah.
Well, think about what you are doing in this very moment. By taking the time to listen to this deep dive, by synthesizing this dense medical data on neurobiology and caregiving strategies, and hopefully by bringing this information up in a conversation with your family or friends later today, you are actively engaging in a complex mental and social workout.
Absolutely.
By simply engaging with this knowledge today, you are already physically rewiring your brain. You are actively building your own cognitive reserve right now. Keep questioning, keep learning, and keep protecting that beautiful brain of yours.